Hi there, I'm Ryan Madnick. This is my video blog from DDW Day 3. It's Monday, May 9th, 2011, and there's only one more day left of DDW, so let's get right into it. So the first session I went to today dealt with performing quality endoscopy. I was particularly interested in the training aspect of this, so there was one abstract I'll talk to you about in particular. This is abstract number 675, presented by Dr. Sedlak out of Mayo Clinic. They used their own their own colonoscopy assessment tool, and it was a tool to assess competency in their fellowship. And what they found was that provided a certain level of, to achieve a certain level of competency as they previously defined, you actually needed on average about 250 to 275 colonoscopies before the average fellow could achieve competency, but up to 400 colonoscopies were required for all fellows. So this was significantly different from the numbers we currently use, which are 140. This has particular interest in that surgeons only need 50 colonoscopies in order to get signed off by their board. So we'll see what comes of that. There was the other sessions I attended today mainly had to do with the esophagus. One point in particular was at the ASGE plenary session. Dr. Ken Chang gave a state-of-the-art talk, and the point that I will bring home here is that in patients with Barrett's esophagus, in patients with dysplastic Barrett's esophagus, there is a significant recurrence rate after Barrett's ablation. Not that it can't be managed, but there is a recurrence rate of about 20% over several years. So in this group of patients, if you're performing radiofrequency ablation, it's important to continue monitoring at least on an annual basis in the dysplastic patients. Let's jump to some of the posters. Poster number 1080 was a training poster, and this assessed an OSCE, an OSCE, an Observed Structured Clinical Examination to assess fellows' management skills over the telephone, something that many fellows and many gastroenterologists and docs anywhere have to do nowadays. And what they did was they scripted a standardized patient with a flare of ulcerative colitis. Some of the interesting findings were up to 3/4 of the fellows did not ask about certain things like sick contacts, food exposures, antibiotic exposures, which is sort of interesting in a patient with diarrhea. The other thing that was noted is that the structured patient, perceived that the doctor told her to go to the ER about 30% of the time, but it wasn't documented anywhere in their notes. So I think we have a long ways to go to teach fellows how to do appropriate telephone skills in assessing a patient and documenting appropriately. The next poster was 1192, and I found this very interesting because it was close to what I do, which is take care of patients with refractory GERD symptoms. This was a trial in patients who were refractory to once daily PPI therapy for at least 8 weeks. They randomized patients to placebo, a second dose of a PPI, or a tricyclic antidepressant called nortriptyline. And what they found was both nortriptyline and the PPI improved symptoms greater than placebo. We'll see what comes out with the paper, but this is some promising data. The last poster I'm going to talk about is 1194. This was a study from AstraZeneca assessing a new compound, lisogabaran, otherwise known as AZD3355, in patients with partial response to gastroesophageal reflux, partial response to PPIs who have gastroesophageal reflux disease. And what they found was that at the highest dose, 240 milligrams, there was a statistically significant benefit. However, it really wasn't clinically significant. They only improved outcomes from 18% on placebo to 26%, which gives a number needed to treat of about 12. Unfortunately, another poster also found that there was some abnormalities in some of the liver tests. This drug has since been discontinued from the pipeline. So we have some ways to go on new baclofen-like compounds. This is a baclofen-like compound to treat GERD. So that's the end of my video blog for day 3. I have one more day left, and see you on the stream.